6 months into intern year, and I consider myself a full-blown doctor who makes a difference in their patients' lives and contributes to patient care. And part of that is being prepared while actually on the hospital floor. That being said, I want to talk to you guys today about what is in my call bag or what's in my doctor bag. I got it right here, and this is what we're going to be talking about today. Alright, so if you guys are new here, my name is Jordan Kai Simmons, and I am a Otolaryngology head and neck surgery resident here in Los Angeles, California. I'm currently in my PGY 1 year, meaning it's my intern year, so I'm just discovering all the nuanced things about hospital medicine, taking care of patients, all of the things that they did not teach you in medical school. I'm learning, and quite honestly, there are some scary moments, but there are some really amazing, incredible, fulfilling moments that consume the overwhelming majority of my time. So today I want to talk to you guys about what I keep on me in terms of supplies every single day in the hospital. So let's get right into it. All right, so first things first, this is my backpack, and as you guys can tell, it is a mustard yellow color. If you guys haven't noticed already, I love mustard yellow, golden yellow colors. So let's take a look inside. So the zippers on this backpack have this like leather tag on them that it's honestly kind of flimsy. I'm surprised they haven't fallen off yet. This little thing is just a lamp that you put on top of your head like so. Unscrew it on the back to loosen it up, and if I can like untangle this thing here, there's all kind of cords and wires that go to this. All right, yeah, I'm losing it right here. There we go. But essentially it's a lamp. You put it on top of your head, and now you have a little flashlight. You can adjust where it goes, you can adjust the size of the light. So these lights are absolutely essential to somebody in my specialty because we're always using our hands in enclosed spaces like the mouth or like the ear, allowing us to be hands-free to manipulate tissues in whatever way we need to. All right, so the next thing that's in my bag here is, of course, my laptop. Now, whether you are in your undergrad years in medical school or you are a resident, your laptop is always going to be an essential piece of equipment. Personally, I always rock a MacBook. I love Mac products, as you can see. I got the Apple Watch, I have the Mac computer, and I have the Mac laptop. My laptop is one of my daily carries because even in residency, you're constantly studying. You do take exams in residency. You have to study for your upcoming cases. You have to do the adequate prep. That means looking up the anatomy, looking up the surgical steps, understanding the patient, and your laptop obviously is the best portable resource for you to be able to do that. So the next thing that I have in my bag is a notebook. If we're having a didactic session or a study day in residency, I like to keep notes by hand. I find that there's something fulfilling about just making handwritten notes, and I think that for me personally, I just recall things a little bit better when I write them down by hand or even draw some pictures. So I always keep a notebook with me just in case I want to write something down. So now we're going to see some of the actual clinical supplies that I use when I'm on the hospital floor. So the next thing that I have in my bag here is my otoscope. We often get consults for people who have had ear trauma or people who have hearing loss, and we always need to do a good ear exam. Got this little light on the bottom, and then all of a sudden you have a great otoscope, have a little light in there, and you can do a quick ear exam when you're on the floor and make sure you are treating your patients with the maximum possible efficiency. So when I first bought this backpack, I noticed that there were no compartments inside the bag except for the laptop sleeve. So I went on Amazon.com and actually bought a backpack organizer. And this thing, you guys, is so clutch and helps me keep my bag extremely organized. Let's just pull it out. So this is one of the bread and butter supplies that I need on the hospital floor almost on a daily basis. This is a general purpose kit. Sometimes we call it a suture removal kit. We have a pair of forceps in here. We have a pair of hemostats that can be used as needle holders or just kind of a general purpose things that need to be clamped. And we also have a pair of iris scissors here. Just little tiny scissors with very sharp tips. Oftentimes I'm using these to pull drains. So if we do a surgery that requires some deep neck dissection, we often will put in a drain so people don't develop a hematoma post-operatively. And we'll use these kits to cut the sutures or the drain stitch and then pull the drain from the patient. We'll use this for taking out sutures post-operatively. If we have a trauma case that required some nylon or some silk sutures, we'll cut them out with these general purpose trays. So in this little section of my bag, I have hemostatic agents in here as well as some nasal packing. So this right here is actually a nasal pore strip. It's kind of this foam puck that you can compress. So what we would do is we take this foam puck, probably soak it in Afrin or oxymetazoline, which is a vasoconstrictor, and then we would pack a patient's nose with it. So if a patient comes in with a nosebleed that can't be stopped. Now, a nosebleed might sound a little trivial to some of you guys, but nosebleeds can actually be fatal, so they need to be packed, they need to be controlled. And nasal pore is something that I have actually used on the hospital floor to control a nosebleed. Also have some Surgicel, as well as a few rhino rockets, and a couple other things that I would use to control nosebleed or any other type of bleeding while on the hospital floor. So I have a lot of different suture material in here. Sutures that are absorbable, sutures that are non-absorbable, some synthetic, some natural gut. I might need to repair a laceration on the face, or maybe bolster a drain that might be falling out, or even put in a drain stitch for a leaky drain hole once I do pull it out. All different kinds of sutures that I may need for whatever reason right here in my bag. And I would use these general purpose trays to input those sutures. And beyond that, I have a bunch of gauze on hand. I have a lot of N95 masks on deck whenever I need them in my backpack, just in case I do get into a sticky situation where a patient might have contact precautions and I don't have the right PPE. I keep some of it in here with me. So definitely this bag organizer is super duper clutch. It's amazing, and it is absolutely essential to my daily carries. And as always, if you guys are enjoying this content so far, please do me a huge favor and gently tap that like button. Give me a thumbs up for this video if you guys are getting value out of this. Please consider subscribing. I'm trying to grow my YouTube channel and get this message out to anybody who finds it valuable. Please share this if you guys don't mind. Back to the video. Now, I do have just a couple other things that I keep in my bag with me. So this is actually a box of more hemostatic agents. This is silver nitrate applicators. And each one of these pouches has a stick in it like this. This is what it is. And that is used for cauterizing bleeding vessels. We often use silver nitrate for consults. If we have a patient with an active nosebleed and we can find the source of the bleed, we will apply silver nitrate to the mucosa that is bleeding, and that will oftentimes be enough to just cauterize that bleed, and then the patient will recover from there. Now, somewhat of a more robust version of that silver nitrate is this pocket electrocautery. Now, many of you know what electrocautery is. It is how we make cuts in surgery but also cauterize blood vessels at the same time. We're using an electric current to divide the tissue as well as seal off or cauterize the blood vessels so we can have a lot less bloody of a surgery. We have this pocket cautery here in case we get into a pinch while we're on the hospital floor. And we need to do some quick dissection if we need to open up the neck if there's a hematoma that needs to be done at bedside. This electrocautery can help facilitate that process. I don't anticipate that I'll need to use this pocket electrocautery very much. Things on the hospital floor are relatively controlled and emergency situations don't crop up that often to where I might need to use it, but I would rather have it and not need it versus need it and not have it. And therefore I keep this supply with me at all times. And this other random item I have with me is a standard endotracheal tube. This is a 5.5, relatively smaller endotracheal tube. I keep this with me just because we do have airway emergencies while on the hospital floor and the anesthesiologists aren't always available. The anesthesiologists are the doctors that will also be the medical managers of the airway, so they keep a lot of these endotracheal tubes with them. I keep one with me just in case we don't have an anesthesiologist available at the time and I might need to perform an intubation. So always good to have one, again, and not need it versus need it and not have it. And so the very last thing I keep in my bag here, you guys, and this is something that is absolutely clutch when on the hospital floor, this is a nosebleed tray. So as you guys may have noticed, I have mentioned nosebleeds a lot. My service, the head and neck surgeons, tend to get a lot of nosebleed consults. They can happen on the hospital floor, they can happen in the operating room. I've seen both plenty of times. And what's astonishing is that a lot of the time when a nosebleed happens, different doctors are unaware of the best methods to control that, so they call my service, who are experts in this field. And we just happen to have this handy dandy nosebleed tray that comes with all of the equipment that you might need to stop that nosebleed right in its tracks. So in this tray, we have a very unique set of supplies that are absolutely streamlined for helping stop nosebleeds and examine noses. So here we have a nasal speculum. You can see this really unique shaped instrument. Kind of looks like it has a beak on it and these handles that if you squeeze, the beak opens up The idea is to put this in a patient's nose, open it up so you can get a better visualization of their nose and their nasal anatomy. Next, we have a Frazier Tip Suction. The first step to stopping any major bleed is identifying the source of where the blood is coming from. And this Frazier Tip Suction has a really narrow tip on it, so you can point to essentially the exact spot where the blood is coming from, suction it, identify it, then you can come in with your silver nitrate, cauterize that blood vessel, or put your packing in the right exact spot to get that nosebleed stopped, tamponaded, and get that patient on their way to recovery. Next, we have some bayonet tip forceps. So these bayonet tipped forceps are super helpful in actually inserting packing. They are made ergonomically kind of in this S shape so that your fingers do not get in the way when you are utilizing this instrument in such a small space like the nose. All right, you guys, that's a wrap. That is every single thing I keep in my doctor bag when I'm on call on the hospital floor. I love this backpack. This is like my favorite color. I'll probably keep this forever. Now I just have to put every single thing I took out back into this bag. So thank you guys. If you enjoyed this video, of course, give me a like, consider subscribing to my channel. Let me know what you guys think in the comment section. What do you guys carry in your bags? If you're a pre-med student, what do you carry in your backpack? Medical students, what do you carry in your backpacks? I know when I was a student, I carried my laptop, my iPad. I avoided carrying any books just because I like to keep things digital. But one thing I always had was some snacks. So let me know what you guys carry in your backpacks. As always, if you're still here, I appreciate you joining me. I love you guys. I appreciate you guys. I'll see you in the next one.